Okay. That's interesting because when I think about it, I heard about holistic wellness, I think through Facebook. I was scrolling through Facebook, or Facebook will pick up on some of your trends and send you things that relate to what you look at and what you listen to. And that's how I found out about it. And just clicked on the link and started reading the information and became intrigued and wanted to involve myself in it. I thought it was empowering and impactful as well. You know, I am a physician, but I also have always been willing and open to not just traditional medicine, but to alternative and holistic, but had not really learned, of course, that much about those areas in medical school. And then you get busy afterward, you try to read and just don't have the time. So when I listened to the video and got more pulled in and intrigued by what information I was learning, I was saying to myself, well, this is definitely something that I want to do. I want to say I really did it. I felt that, you know, the entire staff, including, you know, yourself, would always check in, was always willing to answer any questions that I might have, would give me, you know, great information anytime I would ask questions, or give me resources to go to that, you know, help improve my understanding of whatever question I may have had. I really felt like I wasn't alone. You know, I felt like there were people always there cheering you on, encouraging you, and available when you needed them. So that was great. And, you know, I felt like it was 5-star services. And unfortunately, you know, in the medical world, that kind of service is what you want to give, but you don't have the other resources to do that. So to have those services available and all of you available, including the workouts, the mindful movement, the grocery shopping, all of those things just made it even better. And you felt part of, I don't want to say a family, but you felt needed, and you felt like, or I should say, I felt needed. I felt that everyone was willing and ready and able to help at any point and to encourage and move forward. So that was great.
I agree with you that I did a short stint in some Western medicine in my life, and there's no time or education on a lot of time or education, I should say, on nutrition or lifestyle or support or your cell phone, right? Or giving out extra time. You know, we're seeing 3 to 5, we limit it to 10 people a day. You know, that's a joke, because I was my first stint in any Western medicine volunteering, just seeing that I wanted to do it before I went to medical school. We had to see 30 to 40, usually 60 to 100 people a day. On a slow day, it was 30 to 40. And so you had 5 minutes per person, sometimes less. And then there's all the paperwork, right? And I'm not saying anything against it. It has its place to save lives, right? And I don't do that, right? And it's such an important place. But insurance limits what you can do, right? And then you're mostly taught, which is wonderful, to save lives, pharmaceutical-based medicine. And then people will come to you and ask you, you know, well, what should I do that's natural for this? And like you said, you didn't have the training or resources or the time, right? And you want to do that, right? I know every physician has this big heart and wants to help people, and you do, but then you're limited, right? By quotas, the hospitals, money, all that. So I appreciate that. What would you say to someone perhaps that's a physician, just helping them understand the major difference clinically between what we're doing here and what the oncologists are doing for you?
What I would think is definitely the more natural, holistic approach to what needs to take place in whatever illness process that you have. As you mentioned, the Western medicine, or what we consider traditional medicine, does have a focus more on medicines or pharmaceuticals, wherein with the holistic wellness program, it's just that, holistic. What natural products or what natural things can be done? What foods do you eat? What supplements do you take that are more, the word natural keeps coming up, but that's what it is. It doesn't have the chemicals in it. It's more suited for your body. So I think that's the difference for me. Yeah, absolutely.
Or we can work together if we do need it, right? Well, let's also work together to help with those side effects or with the low energy, right? And that's really what we're looking to do, is to help you feel your best and be a team for you, not against anyone.
Yeah.
Right?
And I think that's what my experience has been. My medical team has never been in a position, or no one has ever said, oh, don't, you don't need to do that sort of thing. They embraced it as well and have been interested. So I think I'm more than blessed to have that support on that end as well. Yeah.
How would you say the testing that you had done was different than the tests that your oncologists were running in your cancer care?
Well, I mean, the test that I had through the program was, urine, looking at the hormones that are being produced in the body, as well as the, stool, looking at what the byproducts are from various things you eat and from the chemical and hormonal breakdowns inside your body. So the oncologist did more blood work to check my, CBC, to see whether or not the medications that I'm on are being affected, my bone marrow and things like that. But some of the hormones, knowing the medication that I'm taking and looking at the hormones, although the blood work, the urine the first time was done before I started the medication. So it'll be interesting now, since I've been on the medication and done more urine, to see if there's any difference as well. But to answer your question, the difference has been the blood work done through the holistic wellness program was hormonal based completely, I think, as well as looking at gut enzymes, gut flora, which is very different than what was done with the hematologist, oncologist, which is just more looking at my CBC, looking at my red cells, my white cells, those sorts of things.
Yeah, and I like how you explained it, because we do have physicians or oncologists that are wanting to know what we're doing and the difference. And as a physician, do you feel, I know that you had your own specialty, but do you feel that your team or you have had in-depth training in hormone metabolism tests and gut microbiome tests in medical school?
Oh, no, not at all. You learn about hormones in endocrine. And because of my subspecialty, some of those hormones I'm very, very familiar with and work with them with a lot of my patients, but you don't learn about the gut, enzymes, or the breakdown of the gut enzymes, or the breakdown of the hormones and how they're excreted. Because I know we talked about that, and it's so funny because I was looking back at my notes, because I constantly have to remember about the changes in the hormones and how they're excreted in the urine and in the stool. So those are not things that you learn about in medical school. Yeah, that unfortunately we kind of know that that's where boils down, and you have to move through that and understand that just using not making it more and more expensive to treat an outcome that could have been prevented, that whole mindset has to be changed. And I think that we're kind of moving in that arena, and understanding that in and of itself, if you start off the right way, you're going to prevent the diabetes, you're going to prevent the heart disease. So I think that they're seeing that and realizing that, all of this illness is weighing on the economy. Not only does it cost more to keep people healthy or to work on disease processes that could have been prevented, it also impacts on your workforce. Because you have all unhealthy people. So how can they be productive? So they're seeing that now, which is, better late than never. So I'm optimistic and definitely hopeful that some other ways of training, like you said, healthcare providers to look at intervention versus, prevention versus intervention.
What would you tell that mom that feels like it should be covered by insurance and I'm not going to do anything that my oncologist doesn't recommend and it's not covered by insurance? What would you tell that person?
Well, I mean, one thing, I think if they're saying they're not going to do it because it's not covered by insurance, definitely brings up the whole financial aspect of it. And that's something that and you even said in the beginning of this talk about you want to take care of yourself, because if you don't, then you're not even available to take care of your children. And you also want to be a role model to your children. I have to admit that it's actually the kind of the reverse in my situation. My daughters are always or constantly on me about taking care of myself, and you do too much, Mom. You're all these organizations, all this community service. What are you gonna do for you? They constantly. So part of me is happy because I play some role in raising them. So at least I guess they realize me is important. But I think for someone who might be hesitant to take care of themselves, that's where it starts. You have to take care of yourself. And when we look at expenses and what we do spend our money on, we can redirect it. I think I would suggest, I don't want to say we because, I can't necessarily speak for anyone else, but I could say I would suggest redirecting your funds. There are definitely opportunities and ways to do that. So I would recommend looking into those other options to be able to engage or enroll in this program. So that's what I would definitely say. As far as the part about the physician saying, I'm not going to do anything unless it's sanctioned by my physician, I will once again just come back to my own situation and say that I guess I was blessed to have a team of physicians whose mindset did not fall that way. And I do, as a physician, I think if you have that absolute mindset that only traditional medicine is the way to go, for me, I think that's a little limiting. I think that's, for me, it wouldn't be what I would want to present to my patients. I want patients to have full opportunity on all levels. And I think a lot of physicians nowadays do recognize that combination integrative medicine is definitely a better option for a patient than just totally one way of doing it. So I mean, I would encourage patients to look at all of their options, and that's something that usually is recommended, when you're counseling patients or you're talking to patients, and not to have just one absolute way that something is done. Because I feel definitely more mental clarity and more focus. I feel empowered because I've learned how to minimize my stress and how that stress affects my body. And the empowerment comes from, a lot of the suggestions that even you have given, the grounding, the breathing, the listening to tapes when you're tapes of yourself when you're having, procedures done or things of that nature. So the empowerment is really one of the main things that I walked away. Empowerment, being more educated about food, about shopping. I mean, I've enjoyed really learning all of this and being able to put it together, and things that I didn't know or understand. I won't say that I'm a expert, but I feel a little bit more knowledgeable and know that there's resources that I can go to and even improve my knowledge more. From a health perspective, once it also feeling more energetic, not as tired or unmotivated, which I already mentioned about being more motivated. I guess also, meeting my goals of what I wanted to do when I, started the program. And I think feeling that I have worked on ways to decrease inflammation in my body, ways to decrease, I should say, toxicity in my body. And I guess lastly, feeling that I am clearly on the trajectory of more optimal physical, mental, as well as spiritual health. And I appreciate the coaching and, like I said, and the support, because it's not easy, as you know, and I would say it's not easy, but to know that you have a supportive team or a supportive group of people working to help you and cushion you and help you get to where you want to go is very important. And also remembering, that the team remembers that you're human. No one, I never felt, even when I may fall a bit behind, the little reminders, I never felt like I was being admonished in any way. It was more to support and say, okay, is there anything that we can do to help, or you can do this, and that's important. That's important, because life is a lot. I will definitely say that, and I think all of you recognize that as well. But I also think that you recognize that the success of, for lack of a better word, of your clients is your success too. So being a physician and knowing that you want your patients, you want your clients to be successful, even if it's a small success, because it makes you feel better. Not that you're not boastful or conceited about it. It's just that to see someone else do well, is a great feeling.
When you have this, it's just a nice reminder that this is why we do this. This is priceless, right? This feeling right here that you have for yourself, or that I get from helping, like, it's just what drives me. Mm-hmm. People ask, like, well, if you had money and didn't have to work, what would you do? I said, exactly what I'm doing right now. It makes me so happy. And I know you feel that. And I know that's what drives you too, right? To every day.
This diagnosis was made. That was a bit overwhelming. So if I include that in the feeling, just being overwhelmed, being, of course, scared, even as a physician, being, angry somewhat, or questioning what's going on, why, I don't understand, all of that. To now where I've had an opportunity to, I guess, in some way, take some control over those feelings, and take control in a sense of clearing out, cleaning, detoxifying, and that being empowering in and of itself, makes me feel less confused, makes me feel that these are things that are necessary to live a longer life. And I think having started the program when I did, at the point where I was still, doing treatments and things of that nature, also for me, and maybe I'm not the best person to answer that, but I think it helped me with a lot of side effects and things that I didn't experience, that, they would ask me, well, skin related issues with the radiation. I had advice from, I believe it was Melissa, about oils to use. So a lot of that I didn't even experience. And to me, that meant something. That meant that this is really working. I have some, colleagues of mine that kind of tease me about, everything is holistic, that, or organic that you eat now, pay so much money for that. And, does it really make a difference? And it's so funny because I don't even respond. I don't need to respond to that, because I then have other people who will say to me, wow, you look different. Your skin is bright. What's going on? You've lost some weight, which was not my intention really, but all of those things counteract the negative, and in my mind also reinforce that what's being done is working, is important. So I think I feel now, like I said, more empowered. I feel more energetic and ready to continue, I don't want to say fight, but continue my journey to continuous good health. I think my final words would be, it's definitely not going to hurt you. Try it and see. If you're on the fence, that's a good thing. At least you're on the fence. You haven't made a decision on what side you sit. You're on the fence. So try it. I mean, it can only help you. It's not going to in any way harm you. There's nothing to lose, basically. There's so much more to gain from the process. There's really, I don't see anything that you can lose. So I would encourage you to try.
So much and all the much.
Well, thank you so much. I mean, thank you for putting this program together. I mean, I know it may have taken a while to catch on, but you're doing phenomenal work, and I'm glad that you pursued through it to make sure it is available to anyone who is interested. Done a phenomenal job and continued great work that you're doing. I appreciate you and your team, and thank you so much.
I just wanted to thank you. Thank you for thanking me, but know that like you, I received plenty of criticism from all the physicians and lawyers in my family and veterinarians that judged me for doing this, but it wasn't about that. It was just me and my mom that came together and prayed, and we knew this is what God was calling me to do. And, I had almost as much debt as most physicians, but I knew a lot less money, but it was about doing what I knew I was put here to do. And I thank you for thanking me, but just know, like, the giving back like this, like, and having your case, I know it gets me emotional, but like, it makes me so happy. I've been doing this for a decade, but like, it doesn't cease to that. I know every day I'm just so thankful to do what I do because I love it. And I'm so thankful I could afford my organic food. That's all I need, right?
Right. That's right. Well, continue.
We appreciate that. Thank you.
Many blessings to you and your family.
Thank you so much.